So hi, I am here now again to have or to perform a procedure of removing or discontinuing IV medication or IV therapy to the patient. So first things first is to review or to check the doctor's order or the physician's order to confirm that the doctor has ordered to that patient that he ordered discontinuing the IV medication. So afterwards is that we are going to wash our hands, or if not, we are going to perform a hand hygiene through the use of the alcohol. Afterwards is that we are going to prepare all the materials needed, which is the sharp container, the gloves, the alcohol, the plaster, and the cotton or the cotton swabs. So after that is that we need to put all the equipments or materials to the bedside of the patient. So after moving into the patient's room is that we need also to introduce ourselves back and to explain the procedure to the patient to provide his cooperation also. So sir, I na-notice or na-notify di mi nga mo discontinue ka sa imuhang IV insertion. So ato ni siyang kuhaon, amo ning kuhaon ang gi-insert nga cannula sa imuha, and then ay nagkabala ka sir kay dili ra man siya sakit. Okay ra ba sir? Okay ra sir? Okay. If he approved that is okay with discontinuing of the IV therapy is now, you can proceed to the procedure of closing the regulator to stop the flow rate to the vein of the patient. And afterwards is that we need to get an alcohol and a cotton ball or simply the alcohol swab to wipe the part of the patient which is having the plaster. So wiping the patient's area with the plaster, it is to use a cotton balls with alcohol swab to the plaster attached to the patient's tube, is that it is to minimize the effect of pain that the tape or the plaster and the skin has a connection. So we need also to consider that the area or the way of the hairy area of the patient is into, because this is to avoid pain also in detaching the plaster. So for the patient, the way that his hair or the body hair is going into is to the right. So we are going to detach the plaster to the right also. And then we need to put it on the waste receptacle. So for the last plaster detaching, in detaching the last plaster, which is in the area of the butterfly of the cannula, is that we need to hold it for a while, and then we need to get the dry cotton balls with the plaster also, and then we need to detach slightly And then we are not going to detach right away because it might have a burst of blood or urging of blood from the vein or to the site of injection. So to avoid that is that we are going to put the dry cotton with a plaster onto the site of injection, and then we need to detach the cannula to the injection port slowly, and then afterwards, or a second after detaching the cannula, is that we are going to apply a pressure to the cotton balls. We need to have a gentle pressure to the site of injection. So if the patient is able to do so, let them be. We need also to discard this by removing first the cannula to the sharp container, and then we need to roll the tubings like this. And this will be put into the disposable container. That would be all. Thank you.